According to Young et al. In the New Zealand Medical Journal article, Emergency Contraception, Why Women Don't Use It, a study showed that 72% of women who were tested in a study stated that they knew of the emergency contraceptive pill, but only 7% used it. This lack of birth control use is contributing to more issues, such as poor women's health and abortion, than one would expect. After completing much research, I found that the reason why so many women don't use birth control is its lack of availability, and this issue could easily be resolved if it was available over the counter. So during my speech, I will tell you why the process of getting on birth control is a problem, how this drug meets all over-the-counter criteria, and the benefits that would be expanded to more people if birth control was easier to access. Now, the reason why so many women don't use birth control is it requires a prescription. And as you can see, the problems that come with getting a prescription include the difficulty of making appointments, the time that one must set aside to attend these appointments, and their cost, as not everyone has insurance. In fact, Daniel Grossman stated in the British Medical Journal article, head to head, should the contraceptive pill be available without prescription? Yes. That seeing a doctor regularly is a requirement for getting a prescription, and making appointments are challenging. In addition to this, Dennis and Grossman stated in the Perspectives on Sexual and Reproductive Health article, Barriers to Contraception and Interest in Over-the-Counter Access Among Low-Income Women, a qualitative study, that various barriers, such as unaffordable copays and clinic visits, restrictions on the number of packs of prescriptions purchased monthly, and the limited time frame in which to purchase these prescriptions deterred consistent use of preferred methods. In addition to this, one of my friends recently said that she and her family haven't been to the doctor in over 2 years, and that's simply their personal choice. Just imagine the number of people who don't go to the doctor because they can't afford it. Now, these issues could easily be resolved if birth control was available over the counter, and this can happen as it meets all over-the-counter criteria. In fact, according to Grimes et al., an obstetrics and gynecology article, Emergency Contraception Over the Counter, the Medical and Legal Imperatives, that birth control meets all over-the-counter criteria, such as low toxicity, no potential for overdose or addiction, no teratogenicity, meaning that it can't affect the growth and development of a human being, no need for medical screening, self-identification of the need, uniform dosage, and no important drug interactions. Now, I said earlier that using birth control has many benefits, but this includes reducing the number of abortions and even eliminating certain health risks. Young et al. Also noted in the study that I discussed earlier that of the women who were tested and seeking abortions, most of them said that they would have used birth control if it was available to them over the counter. I will now share with you statistics regarding the number of pregnancies that were avoided in United States teenagers through the current use of birth control. According to Kahn et al. In Family Planning Perspectives article, Pregnancies Averted Among United States Teens by the Use of Contraceptives, that current use of birth control estimated an aversion of 1.65 million pregnancies. Now, had these girls been denied access to both prescription and over-the-counter methods, then 480,000 births, 390,000 abortions, 120,000 miscarriages, 10,000 abnormal pregnancies, and 37 maternal deaths would have resulted. Now, since this is through the current use of birth control, just imagine how many more unfortunate scenarios could be avoided if birth control was easier to access. In addition to preventing unwanted pregnancies and their inherent health risks, Trussell et al. From the American Journal of Public Health noted in the article, should oral contraceptives be available without a prescription, that birth control can prevent ovarian and endometrial cancers, pelvic inflammatory disease, ectopic, meaning that the baby develops outside of the uterus, pregnancies, iron deficiency anemia, primary dysmenorrhea, functional ovarian cyst, and benign breast disease. It can also prevent smaller issues such as acne, abnormal bleeding, and even premenstrual syndrome. Now that you know of the benefits that come with using birth control and the reason as to why so many women don't use it, I encourage you to advocate for this drug to be available over the counter so that more women, such as younger and low-income women, would be able to use it. I will now close with a quote by Senator Jeanne Shaheen. We know that the way to decrease unplanned pregnancies and abortions is to make birth control and family planning services accessible and affordable, not micromanage the type of medical information and reproductive health counseling that women around the world receive. Thank you.